Welcome to the COOP for Rural Hospitals webinar series. This is webinar number 1, How to COOP. In this webinar, we will review the COOP planning roadmap and planning process. Before we begin our webinar, let's review the components of the Rural Hospital COOP Toolkit. While this toolkit was designed specifically for rural hospitals, other hospitals or other healthcare organizations may find benefit from the elements in the toolkit. This toolkit has been specifically designed for rural hospitals and includes 6 components which you see listed on the graphic on the screen. The first component is a COOP plan completion guide, and the second component is a COOP plan template. These are designed to work together to help hospitals customize their COOP plan. The third component is a COOP tabletop exercise in a box that includes all the materials you would need to design and conduct a tabletop exercise at your hospital. The fourth component is a collection of resources related to COOP planning, specifically COOP planning industry standards and best practices. This curated list of resources may be helpful as you write or update your hospital's COOP plan. The fifth component is a frequently asked questions document to help you explain COOP planning to your peers and executive leaders. The sixth and final component of this toolkit is this series of webinars to help continuity planners complete or update their hospital's COOP plan. The webinars are focused on the first 2 components of the toolkit, the COOP completion guide and the COOP plan template. The completion guide has been designed with activities and explanations of how to write a COOP plan for your organization. As you complete the activities, you can move answers into the COOP template. The template can be edited or adjusted however you see fit to meet the needs of your organization. If you already have a COOP plan, you can use the completion guide to help augment or revise your current COOP plan. And now for webinar 1, How to COOP. In this webinar, we will focus on the COOP planning process. This is a roadmap graphic that describes the 4 phases of COOP planning, and each phase corresponds to a bend in the road. There is a red chess piece that will move with us as we progress through this roadmap and progress through the webinars. Step 1 in the COOP planning process is to prepare. Preparing includes building your COOP planning team and setting up your project management plan, as well as understanding the COOP planning elements and the regulatory environment. Webinars 1 and 2 focus on step 1. Step 2 in the COOP planning process is to write your COOP plan. Webinars 3, 4, and 5 guide you through writing your COOP plan and using the COOP completion guide and the COOP planning template provided in the toolkit. Step 3 is to train and exercise so your staff know how to activate the COOP when needed. This will be covered in webinar 6. And finally, step number 4 is to evaluate and improve your COOP plan. This will also be covered in webinar 6. We will refer to this roadmap graphic and the 4 steps of COOP throughout this webinar series. Here we see our roadmap again, and our red chess piece has moved to step number 1. In this webinar, we will focus on COOP planning strategies, building your planning team, and designing your COOP document. Before you embark on your COOP planning efforts, it's important to have a clear strategy for COOP planning. Like the image of a chessboard here on the screen, there are a lot of different ways to accomplish this. Here are some suggestions for how to complete your COOP plan. First, you can identify your organization's essential function and carry those to the departments that support those essential functions. Second, you could work with your departments to identify their essential functions and then roll those up into organization-wide essential functions. Third, if you are on a campus with multiple buildings, you could focus on COOP planning by building. Perhaps you work on the hospital building before a medical office building. Fourth, You can focus your COOP planning efforts at the department level. And finally, you could focus your COOP planning efforts by service line. Think of this like focusing on critical care or primary care or another service that your organization provides. There also could be other strategies to complete your COOP plan not listed on this slide. If you have a different strategy, you can use that to complete your COOP plan. Another strategy you can use during your COOP planning is to think about the way that you plan for medical surge. Those same 4 categories commonly used for medical surge planning can apply to COOP as well. First, space. This is where essential functions occur or are the alternate locations you have identified. Second, the staff who perform the essential functions. Third, stuff. What kind of equipment is needed to perform your essential functions? And then finally, systems. What kind of technology or other systems are needed to perform your essential functions? Another strategy to confirm is your strategy for project management. You can define how long you anticipate this process to take, like the calendar graphic on the slide, and create a timeline. Within your timeline, consider how many others you may need to provide input into your COOP plan and plan time accordingly. You can also note if there are factors such as regulatory requirements that drive your COOP planning process. The COOP completion guide and template in the toolkit have some additional resources for project management and facilitating COOP planning meetings. To highlight the importance of a planning team, we chose a graphic that shows a team of people working together. Assembling a planning team may be the most important part of preparing to write your COOP plan. It's important to have a multidisciplinary team that can speak about your organization's operations. First, your planning team should include an executive sponsor that can help garner the support you need to write the plan and to make sure that the plan aligns with your organization's mission, vision, and values. A natural fit may be the executive that is already part of developing your emergency operations plan. You should also identify a continuity planning lead. If you are watching this webinar, chances are that you will serve as that lead. Additionally, you should have representation from human resources, IT, and facilities, as all of these relate directly to COOP planning elements. The image on the screen shows a person drawing architectural plans because you can decide how you want to design your COOP plan. There's a blank COOP plan template included with the toolkit that you can use as a base for your plan. You can format this template in any way you see fit and add approved colors or logos or fonts for your organization. You can also use an existing document layout, such as your emergency operations plan. You should decide on your document design before you begin writing your COOP. That brings us to the end of webinar 1, How to COOP. In the next webinar, we will review COOP fundamentals and the regulatory environment that are still part of step 1, Prepare. This webinar was prepared and recorded by All Clear Emergency Management Group under contract with the Minnesota Department of Health Emergency Preparedness and Response Division. If you have any questions, please see their website at www.health.state.mn.us/about/org/EPR.